All right. Hello again, everyone. Thank you so much for joining us tonight. We have Dr. Kris here from Ithaca Family Chiropractic joining us for this presentation on chiropractic care in you. We are recording this so you can view it later on our website. You can feel free to put questions in the chat, and we will have questions and answer afterwards. Or if you're having, a question, you can message me. I'll kind of keep my eye on the chat. If I can ask everyone to please mute just so we don't get background noise, or if you have trouble muting, I think I can mute you. Looks good. Everybody's muting. Thank you. So I am going to pass it off to Dr. Kris and kind of let him take it away. Thanks for joining us, Dr. Kris.
Oh, you're welcome. Hello, everybody. It's nice to meet you all, and it's nice to see you all. Is there any echo from me in the room here? Are we good? Great. That's awesome. So it's a new computer here at the practice, so just making sure it works. So I'm here, and we're going to talk about chiropractic care. Well, let's start with a little video that I think is just cute. It's one of my colleagues and coworkers who I went to school with. She created a short little clip on chiropractic care and why we would do it. So hopefully you guys can all hear this when I press play, but it'll give an extra 3 minutes if anybody else wants to join as well. 4 minutes. Can everybody hear that?
No, there's no volume.
No volume. What if I do that? No.
No, still no sound.
All right, so we might not be able to watch that video.
Dear.
But that's okay. I can always share the link. So here, let me share the link so that if you ever want to, at some point. Oh, it's not going to let me share it either. That's okay. All right. So in that case, though, we'll move on to what we're going to talk about today. So we're going to kind of go back to the basics of what chiropractic is, who I am, chiropractic history, how you become a chiropractor, what the different ins and outs of who regulates us, and then what it means to get an adjustment. The chiropractic care in general, how it's used, the benefits. There's 4 different benefits that we have, in addition to a multitude of others, but these are 4 that I want to touch on that I believe are pertinent to those that have cancer, those that have immune system problems, and those that have other ailments. Also, who should not have chiropractic care, and then I'm going to end with what it looks like to be a patient here at Ithaca Family Chiropractic. How many of you have been adjusted before? I see 1. All right, that's good. I see 2. Great, great, great. All right. So this is just going to be a little bit about who I am. So I'm originally from Syracuse, New York. I went to Wells College, which I'm sure all of you know or have a little bit of knowledge of. It's on Cayuga Lake. It's in Route 90, sister schools to Cornell with Ezra College, or Cornell College with Ezra Cornell. After that, I went over to New York Chiropractic College in Seneca Falls. So that was in 2014. I graduated from there. It's now been rebranded to Northeast College of Health Sciences. They're hoping to branch out to add more majors and minors in the health field from, I believe, physician's assistant to nurse practitioner degrees, as well as registered nurse degrees and so on. Currently, I'm working for Ithaca Family Chiropractic. Our motto, should you say, is take charge of your health. And the animal that we have chosen was a rhinoceros because they tend to charge with their horn. So I thought that was cute. So why chiropractic? So a little bit of why I got into this. So as we look at this, we'll see that my mom, my sister, and my brother were all in the medical field. My brother was an LPN, my sister is getting her RN, and my mom has been in the medical field since well, for 40 years now. So to me, as I was watching her become an RN and I was reading her textbooks, I was kind of going through it going, well, geez, it's a lot of medications and it's a lot of these cause these problems and side effects, and then do this and just add medication and medication and medication. And I said, there's got to be a different way to do that. So I wanted to look for something that was still in the field of helping people, still able to listen to them, talk to them, but to actually able to heal them at their core. So I applied to NYCC for acupuncture and oriental medicine. However, as I was there, what I was looking for and what I was getting out of life and what I wanted to get out of life more aligned with becoming a chiropractor. So I started that journey. It was very happenstance. And it's not been anything that I regret at all. It's been great. So when I come into, first we have a little did you know. So we've got a few of these kind of throughout. So I thought this one was cute because it talks about chiropractic. So the word chiropractic combines the Greek words care, which is hand, and praxis, action. So it literally means done by hand. So if you've been to a chiropractor, you know that we use our hands and our bodies to adjust the individual, to bring about less misalignments, less subluxations, and therefore usher in better health for everybody. All right, so how do you become a chiropractor? A lot of people kind of ask me, so it's an online program, right? Which I'm always shocked by. Yes, it's online. It takes me a day and then I'm a doctor, go. So first, in order to do it, you do have to earn a 4-year degree that fulfills prerequisites that are similar to pre-med. So you've got to get all your anatomy and physiology, your biology, your chemistry, your sociology, everything you've got to be well-rounded. You then apply to chiropractic college. So there's only, I think, 12 colleges in the United States, might be 14 in the world actually, that there are for being a chiropractor. So you have to really apply. It's tough to get in. So once you get in, it's even harder to stay. The first year is just so pounded with classes and coursework. So Northeast, formerly New York Chiropractic College, is different. It's a 5-year program. However, we do it in 3 years and 4 months. So we don't get breaks. We don't get anything. We go in classes for 12 hours a day. We live right on campus and we just go through it. So in order to become a chiropractor, you have to pass 4 boards. Each board exam is a different section of what you need to know. In addition to that, you can get physiotherapy certified. Physiotherapies are ultrasound. It's going to be using your x-rays. It's going to be using your heat, your ice, and it varies depending on which state you function in. You also do a 1-year internship. I did mine in Depew. And then you have to pass all of your state licensing board, not only background checks, but also the scope of practice exams. So each state in the United States is different depending on what the chiropractor can do. So I can take a few extra courses, and I think it's in Oregon, I can perform minor surgery. Like I can take out your appendix, which is insane, right? To think that it's so closely aligned to an MD, and yet so many people still think that it's just an online degree. All right, so this is just a little breakdown of what chiropractic classroom hours look like versus an MD academic classroom hours. So if you look at them, for the most part, chiropractic is higher in all of them. So our total hours are 3,065 versus the average medical school, which is only 2,706. So one of the things that chiropractors are is we are neuroskeletal musculo specialists. So we have to have a very deep understanding of not only physiology and pathology, but also the entire body, the muscles and nerves, so that we can relate it all into a person's well-being. I have another did you know? Around 400 BC, Hippocrates, the father of Greek medicine, used manual treatments to treat spinal conditions. So even though chiropractic was not founded until this slide, no, it's 2 slides from now, until by D.D. Palmer and B.J. Palmer, a form of it has always been being used, whether it's been considered chiropractic care or it's a manipulation. And then there's in the traditional Chinese medicine, there's also a form of adjusting that is similar to what chiropractors do. So who regulates us? There's two different ways to be regulated. We can be regulated at the state level, which is by the chiropractic board. Here it's the Department of Education. Our malpractice insurance also, sends out updates and makes sure that we're doing what we need to do. And then insurance companies as well. So nationally, you have to have a school that's Middle States Commission on Higher Education. You can actually look them up. And you have to have a National Board of Chiropractic Examiners, so NBCE, and a Council on Chiropractic Education. So every year they go through, they make sure that all of the curriculums are up to date and that they're at the highest standards that they can be. So it's a little bit more than just going online to get an education. And it's very in-depth. And a lot of people don't usually know all this, so they tend to shy away. So I just thought it was important that we start here just to really get a view of what chiropractic is and where it comes from. So speaking of which, let's take a look at the history of chiropractic. So it began in 1895. We have D.D. Palmer, Daniel David. He adjusted a deaf janitor, and then the deaf janitor claimed to have restored his hearing. So when we adjust somebody, we're using our hands to adjust the areas of the spine to remove the blockages that are creating an imbalance, that aren't allowing the nerves to be able to communicate with the brain, that aren't allowing the muscles and the bones to be able to work at the highest standard that they're possible. So up until, when was it? 1960s, chiropractors were thrown in jail. It was seen kind of as a pseudoscience. It was also seen as illegal to do. So there were a lot of places too that when you would go to be adjusted, you would actually go in for a colonic. So when I was in school, we were having stories of the older docs. I was fortunate enough to have worked and went to school with some of them that their parents had helped start chiropractic, the educational system for chiropractic in the 1920s. So they were in jail. They said their parents had been in jail multiple times. So they really had to fight for us to move forward with it. One of the things that I think it's important to take away from reading this slide is that we do provide a primary intervention of manual therapy. This is to normalize joint function to patients in recovering from injuries, or to provide manual therapy, nutritional guidance as well. So when you come to a chiropractor, we're not just, hey, adjust. We're usually, and it varies depending on what clinic and what their setup is. But here I like to make sure that I take the whole body into account. Your biopsychosocial model, what's going on in your life, what do you want to gain out of it, how can we help you with nutritional suggestions as well as exercises, stretches, and being able to get you adjusted. So another did you know, Buddhist temples, over 2,000-year-old, contain depictions of lumbar spine manipulations. So that's interesting because it wasn't called chiropractic back then. So, you're looking at these different societies, different civilizations that have used some form of this. And here we are today where we've taken it and we've really started to understand it and put it together into a form of healthcare. So what is chiropractic care? So we can treat a lot of things. A lot of people want to just come to us for their back, but in reality, what we do is more than that. So we can find imbalances in the brain. We can find what's going on with nerve problems. We can find muscle issues. And then we're able to either give you stretches and exercises to help bring that back, but in combination with the adjustment, we're able to clear the misalignments, clear the blockages, and clear the things that are causing the error for the body not to function at its maximum capacity. I like to think about the nervous system as 81. So if you're going down 81 and you have a slow tractor trailer, it's going to block all of the traffic behind it. Now you need to divert and go up. So if one side is blocked and the other side is not, then you're going to have that problem where one side might be weaker and one side might not be. So what we do is we go in and we clear that out. So often we have people that say, well, my back doesn't hurt, so why do I need to come in? And my response to them is usually, do you only brush your teeth when you have a cavity? Well, no, right? You want to maintain what you have. Our body is a temple. Our body is what we're going to have, and it's the only body we're going to get. So if we're able to help maintain that now, then we're going to be able to help keep that for longer. So I always say to people, why wait until you're in pain to see a chiropractor? Don't you go in for, usually a checkup or a dentist checkup or just a doctor's visit to make sure everything's going well? So down here at the bottom, we're going to talk about what it is to be in a typical chiropractic visit. So I think it's worded very well. I actually took this off of a website that was just about chiropractic care. I liked how it was worded. So often you're positioned lying face down. You're in a specifically designed or padded chiropractic table. I don't know if you can see the one behind me. So chiropractors use his or her hands to apply a controlled force. You may hear popping or cracking as your joints move in the treatment session. So the popping and cracking is completely normal. It's actually called crepitus. So it's gas that's being released from the capsules in between our joints. When you do that, you're also releasing the dirt, the debris, and the toxins. So then you're welcoming in clean synovial fluid, the fluid that's in those capsules, and you're allowing them to function at a greater capacity, which is amazing. Do you have any questions so far? Nope, we're good. Okay. So I wanted to look at just what the basic anatomy is of the spine. So when we're looking at the spine, we see here that we have a vertebra. So this is right here what you would feel when you take your fingers and rub them down somebody's back. So that's right here. It's a spinous process. You have the two things that stick out on the sides, and then you have here the vertebra body right there. So this hole here is where the spine cord goes through, and it'll go all the way down and all the way up to the brain. In between these two bones are our shock absorbers, our discs. These are made up of mostly water. So a little bit of trivia, you're actually shorter at night than you are in the morning. And that's because each of these discs gets dehydrated throughout the day. So when they get dehydrated, that adds up to roughly 1 to 2 inches per person, which is insane, right? Water really makes us move, and it keeps us going. So if you see here in these facet joints, you have the bones up top and the bone down below, but in between there, and it's not depicted here, is a little capsule. So if you think about a Mentos, it would be a clear capsule full of liquid. So it's constantly able to be pliable and it moves. So when that bone shifts up and down, it's actually going to have that capsule right there. Now sometimes that can get stuck. So what we do is we go in and we apply that force in a certain direction, which unrestricts that area, allowing it to move more freely. What can happen, and this is what we like to avoid, is degeneration. So over a period of time, your body can break down. When it breaks down, it can cause more and more obstruction on the nerves that come out. So here is a picture perfect bone structure setup. You've got a nice big vertebral body, a nice big disc, and a nice round hole, so that when I move this, it moves freely. Let's look at one that's not. You see how it's not smooth bone? The disc is almost gone. And when you try to move this, there's very little movement. So that's catching on the bone. So what we do is we want to be able to go in and make sure that we maintain. So being adjusted will help to maintain this structure because you're not allowing it to fall back into the patterns that caused this. Have you ever been seated in one position for so long that it hurts when you get up? So that's kind of similar to what happens, except when it happens in the spine, then we start having behaviors where now this isn't moving, but the structures above and below it are moving at a hypermobile motion, which is going to cause faster degeneration of the structures around it. So when you're coming in to get adjusted, we're actually making sure to keep everything as clean and as stable as possible. All right. So let's take a look here at chiropractic care and treatment modalities. So there's a lot of things that we can do. In Florida, we did a lot more than what we do in New York, and that's just because of the different state regulations that there are. So let's see. In Florida, you can do ultrasound, you can do rehabilitation, you can do kinesiotaping, you can do exercises, and you can do all of these in New York as well. Manual therapies, which is moving our hands. And you can also do instrument-assisted adjusting. So that's where we use a tool. A lot of people refer to it as a clicker. And what this does is it puts a targeted force that mimics what we do with our hands through a certain vector to give a similar effect of being adjusted by hand. So we also give self-help advice and diet and lifestyle advice as well. So really, we do a broad range of things, but our main priority and our main focus is on getting that adjustment in. So common reasons to see a chiropractor. All right. You don't have to have any reason at all to come in to see us. A lot of people, when I'm at events, will often say, well, I have no pain, I have no problems. Well, then come on in. There's no reason not to. And what I always find interesting is they come in, they get adjusted, and then they go, well, it's the best sleep I've ever had. Or I didn't realize that I was supposed to be able to move so much easier. Or, wow, this really feels good. And that alone just means, okay, we've gotten used to that dysfunction and we need to clear that dysfunction out. And that's really what you come to us for. Now, here are some big things that people come to us for though: arthritis and headaches. Headaches can be caused by a shift in the very top of the spinal cord that can put a lot of pressure on not only the brainstem, but also the vertebral arteries that come down as well. Whiplash in an accident. So what happens when you have a when you're in a car accident, your head comes forward and it comes back quickly. When it comes back quickly, it actually elongates, and it usually, people do not have the headrest behind the head. It needs to be up here to stop that. So when that happens, it's going to hyperextend these joints. And when that happens, now they get kind of stuck a little bit too far back. So we go in and we realign everything to help aid in not only the proper movement, but to also help stop the formation of scar tissue. So low back pain, most common thing I think that people come in with, right? You would hear that people go, oh, I have low back pain, I'm going to the chiropractor. Neck pain, sciatica, stiff muscles, muscle aches. So we always make sure that everything's moving properly. We always make sure that the muscles are moving properly as well. So when we are actually having you on the table, we'll do what's called palpation. We're going to use our hands to apply light pressure to see how the joints are moving in construct with the joints above and below it. That's also how we identify subluxations or the misalignments, those areas that are restricted for us to clear the restriction. So here, and this is probably one of the coolest slides here, we have some symptomology of poorly functioning nervous system. So you're going to see the vertebrae number, and this goes all the way down, and then you're going to see areas and parts of the body and then possible symptoms that happen. So I'm sure that every single one of us could go on here and find some problem. So one of the things that I think is so interesting is a lot of the times people have difficulty breathing or asthma. They'll come in and they'll get cleared out. So if you can find asthma, you see that it's T1 right here. Now, oftentimes too, people will have difficulty breathing or asthma or shortness of breath, and it's a problem with not being able to get their ribs to move in conjunction. So some people don't realize that that's something that we can help with as well. If we get each of these segments of the spine interacting with the ribs at the ideal amount, then they're able to come out every time we inhale or exhale. You'll see right up at the top, headaches, nervousness, insomnia, head colds, high blood pressure, neuralgia, neuritis. So neuralgia, neuritis, so a lot of people, you get burning, like a burning pain in your fingers and your feet. And that could be from an obstruction on a nerve that's creating the nerve down the line to go, hey, ow, this hurts. So we come in, we get you adjusted. And it doesn't mean that being adjusted is a one-all. It's not usually just a one-time thing, which is where I think people get a little scared. I often get the same remark, well, once you go, you have to keep going. And I said to some people, you know, why do you think that? And they go, because you feel so good that you just want to continue to feel good. So when you don't go, after, you know, a few weeks, you start to get into your bad habits again. You start to have that poor posture, those slumped shoulders, and then you form that scar tissue, and now you're getting back to that decreased range of motion. So you come in and you get down to that maintenance level care that is going to keep you regular, and that can be different per person, and that's what we find. So are there any symptoms on here that people are shocked on or surprised by?
This is Nancy.
Hi, Nancy.
Hi. I'm thinking with the lung, I mean, that makes sense when you think about it, but I'm a lung cancer survivor, and I didn't realize that it's so important with the breathing, like you say, even with asthma and so on, that can help.
It is.
How often do people usually come in for adjustments and so on with something like that?
With the cancer or with a breathing problem?
With the breathing, like shortness of breath, or
So a lot of people come in and they don't realize they have shortness of breath until after the adjustment, and they go, wow, I can breathe easier. So one of the big things is that chiropractors, like I believe it's a slide before, said, not only do we make sure to get the spine realigned, but we make sure the muscles around the spine are functioning at their maximum capacity too. So if that's the case, you've got all these muscles in your ribs that need to be able to pull the ribs up and out. And if they're not able to, because we are stuck in this motion, or we're hunched forward, or we're just not expanding, then that's where it's going to be difficult. That's why you're going to have that breathing. And then once we go in and we get everything back in line, and then you stand up taller and you take that breath. And you're like, wow, that's what it feels like to breathe again. And it's nice. So it's more often than you think. And we get people that, again, like I said, are shocked by how easy it is to breathe. But not too many people know that all of these issues that we're dealing, that are in the symptomology column, are things that chiropractic can help with. And that's because everything comes back to what? The spine. And everything comes back to the nerves, and everything comes back to neurology. So when we're fixing and healing the spine, we're fixing and healing the spinal cord and the nerves as well. Yep.
It's very interesting. Thank you.
It is, yes. Anything else for anybody? All right. I will tell you, so if you look up here, we have hearing loss. And then let's see, where is tinnitus? So I see tonsillitis. So there's tinnitus, which is ringing in the ears. I have a patient, there is an ear adjustment that I've been doing. She's had considerable decrease in her tinnitus, and she's had tinnitus for 25 years. And I don't know what that's like to have a constant ringing all the time. But she's been coming in, I've been doing that, and she's like, it's great. It's so decreased that it's a different way of living now. And she came in and she said, you know, it had a flare up over the weekend, and I don't know why, but I knew I needed to come in and get adjusted. I adjusted her and it went right back down. So that's great, and that's amazing. Then we also have different throat conditions, sore throats, stiff necks, pain in the upper arm, tonsillitis. So along with ear infections, which are big in kids. When we go in and we do that upper neck adjustment in children, what we do is we're actually clearing out not only that imbalance for the nervous system, but also the auditory canal. And we're allowing everything to drain properly, and we're allowing everything to drain back in the throat more properly. So those are great benefits there as well. So all of these things are great, and all of these things are great together. And again, I think it's Albert Einstein who said, when looking for the cause of disease, look to the spine. All right. So you're not gonna be able to hear this one either. It's another great little video about the tech neck. So let me just talk about the tech neck a little bit for a second. So we've actually have a new diagnosis code that's now acceptable in the recent years by insurance standards, and it's tech neck. So the most common thing is that we tend to do this, and we tend to roll our shoulders, and we tend to hunch ourselves down. So when we're doing that and you look from the side, we're now bringing our ears more over our nipple area rather than over our shoulder, and we're rounding our shoulders. When we do that, we are decreasing the amount of space that we have in our lungs. So we're not bringing in the air that we want. We're decreasing the oxygen to our brain, and we're lowering our concentration skills, which is not what's needed. All right. So what we want to make sure, and this is something that I tell my patients, when you're sitting at a computer desk, you want to take a red or a green dot, one of those sticky dots, and you want to put it just at the level of the monitor behind you on the wall, so that when you're like this, you can see the top of the dot. And then as you're going throughout the day and all of a sudden you can't see the dot, you don't move your computer, you move yourself. This is going to help. And just a little bit like this over the course of a week is going to change everything drastically. And now you're going to be breathing easier and breathing better as well. All right. Let's go ahead and take a look at the next slide. I'm just going to try to play it. Oh, thank you. The next one. Yes, it is. So who shouldn't be adjusted? It's a trick question. It's a trick question. No one, everybody should be adjusted. So we can modify adjustments pretty much to suit whatever we need to. Dr. Brian has kids, they get adjusted immediately after birth. I have adjusted people as old as 99. And that's just because I haven't had any patients that were older. So a lot of times people wonder, well, what does that look like in a child? Well, in a child, it's a lot different than what it is in an adult. So in a child, it could be as simple as finding a subluxation or a misalignment, the area that needs to be moved, and you press it with your finger and you just wait and you vibrate. And that's because they're so small that that's all that they need. It's not a full adjustment like it is for an adult. So again, one of the great benefits that we've had with that is ear infections, concentration. We've had people that have had ADD type symptomology. They get adjusted and they do a lot better. My niece, who was born on the same day as she was, I want to say, mute for the first 2 years of her life. I adjusted her for 4 months and she began speaking. So that was great. Is it just from the adjustments or a combination of things? Who's to say? But getting her adjusted, I think, was definitely a key contributor in being able to have the body work in a more natural way again. All right, so kids, who else? Let's see. Those that have cancer, if you're going through radiology or chemo, they tend to tell you that you should probably wait roughly 12 weeks after you finish in order to be able to have adjustments. And that's also very dependent upon what kind of cancer you're going through, what kind of radiology and chemo it is, to make sure that we haven't made the bones too brittle. However, we have instrument-assisted adjustments that we can change the intensity of how we're directing that vector or directing that force. And for the most part, we will be able to help ease some of the things that you're going through, whether it's the muscle pain or headaches or joint problems throughout your treatment. So that brings me into this next study. So when we're looking at this study, it was about panelists. Now the panelists were chiropractors that have different offices. So one said, cancer patients seek chiropractic care for neurological complications, eyesight, balance, dizziness, autonomic nervous system complications, and weaknesses. So these are all things that we're able to help with and all things that we're able to assist in. Oh, absolutely. So let's digress for a moment. Somebody would like us to talk about chiropractic and osteoporosis. So osteoporosis, there's the diagnosis of osteoporosis, and then there is just the way that our bones tend to decrease in density throughout our life, right? So when you have an osteoporosis diagnosis, usually your DEXA scan, the scan that looks at your bone density, is below a certain number. Now, again, we're still able to adjust these patients, and we would still be able to have them reap the benefits of the adjustment. We would just need to use a lighter adjustment, or we would need to use the activator, which is the instrument-assisted adjusting style, both of which are able to provide the same results. It just takes, which one are we going to do? Yep. So in terms of the modifications, we would do the instrument assisted. We would also be able to do more of a slow manipulation where we are not doing it's called HVLA. It's a very fast movement that brings the joint to its end range, provides you that release of that restriction. So instead, we would do it more slowly, and we would be able to still get them the same results needed. And do you have a follow-up on that, or do you want me to continue? All right. So let's continue with chiropractic care and diagnosis. So when you seek the care after cancer has been diagnosed, there's a lot of things going on in your life, of course. So one of the things that chiropractic, we can't say that we can cure cancer, we cannot. However, if we're able to assist in helping the body function at a better, in a better way, in a better homeostatic balance, then we're of course going to be able to help with some of the symptoms that are associated with your diagnosis and with your treatment therapies. So looking at this, we've got from this one study, people that have said, hey, we just need to make sure that you don't have any of these, what we would call red flags, that say that we can't do these things. And for instance, a red flag for chiropractors would be a cancer diagnosis of bone cancer in the spine. That would be something that we would obviously stay away from. However, again, we can do modifications. We can use the instrument-assisted adjusting to be able to bring you some of these benefits in other areas. So we can still look at the muscles, and we can still treat you using other ways that'll help. So it's not that we can't, it's just that we need to formulate how. And that's where often during your visit, we have a paperwork, we have the exam, and then we go through and we say, you know, surgeries, treatments, blah, blah, blah. And unfortunately, there's a time where people go, well, I don't think you need to know this, but we do. And we do need to know all of it so that we can make the best decision on what method we're going to use to treat you. Any questions on this slide? Okay. So another, did you know? Beginning in the 16th century in Europe, spinal manipulation was commonly associated with bone setters, tradesmen and women who learned the craft through family apprenticeship. So it was called bone setters, and this is where it's kind of interesting. So we have bone setters and we have like a bone out of place. So what we used to call it, where it was a bone out of place, is where it would be a restriction. So what we call that, it would be a misalignment. So you would be like this. However, the body is super smart and awesome and will come back up a little bit further this way to still make that straight. So you don't know that it's out of place, right? So we do the adjustment, which then allows you to, this is a lot more difficult when you're doing it in reverse, which then allows you to be more straight and more aligned. So you can. So I have a question about whether or not we can do an adjustment on an arthritic knee. Okay, so what is arthritis? Arthritis is the degradation of a joint It's the changing of the bone that causes it difficult for the joint to function. Of course, there's different forms of arthritis. You can have rheumatoid that would give you the eating away of the joint. So if you have arthritis in the knee and we're doing the adjustment, what we're helping to do is to, depending on how bad the arthritis is, we're helping to restore, well, let's do it this way, as much of the normal motion as that knee is able to have. Because if you start to, so we have the normal functioning knee, if you start to have the degradation and you're not having chiropractic care, and say it starts to hurt after this point, you don't want to bend it that far anymore. So now you're only going to there. So when we're adjusting you and we're getting that full range of motion back, you're able to keep moving, which is going to stop that degradation all over. So it's going to slow that process. So it's going to give you more life out of that joint for longer. So when we do a knee adjustment, there's a few things that happen. So when you have a knee, this is going to be a very awful drawing and it's going to look more like neurology. But so when you have the knee, you have the femur, you have the tibia, and then you have the fibula. So this actually works in more of a corkscrew instead of an actual just up and down. So what we do is we're able to gap this area and we're able to move this fibula, which communicates with the ankle, so that that gap works as well as it's supposed to as well. Then that patella will sit directly over that gap. And what happens is you get the infrapatellar tendon and the suprapatellar tendon, which then goes to the quads. So when we're able to do that, we take the patella and we actually move it in a 5-star, so that we're able to make sure that that has its full range of motion as well. So when you're looking at arthritis, you have to really find out what kind of arthritis is it and what's going on with the joint, whether it's pain or decreased range of motion. So if you're having that decreased range of motion, let's find out why. Because one of the things that I think people fail to realize is that all a joint is, here's another one of my awesome drawings. Because all that a joint is 2 bones connected by tendons, ligaments that go around, and muscles, right? So if this is too close, if there's no gap there and you've got them rubbing next to each other and there's no gap, something's probably pulling them too close together. They're too hard. So if we go and we're able to stretch these muscles and restore that gap, we're able to restore more of that motion, right? I had a patient in Florida who on Thursday, he was scheduled, so this was a few years ago, on Thursday, he was scheduled for a double knee replacement. He came in on Monday. I worked with him for 4 hours on Monday and 3 hours on Tuesday. He ended up canceling both of his knee replacements. 2 years later, he still didn't need them. And it was because I went through and I did all of the work on his legs. I stretched all of his quads. I stretched his hams. I worked on everything below the knee as well. And it helps him restore the natural range of motion. Because of course, you go to a surgeon, they're going to want to cut. You come to a chiropractor, we're going to want to adjust. So that's what they saw. Now, did that take away the damage that was already in his knee? No, because when you have damage to a knee or any joint, you're going to have things coming off of it, whether it's osteophytes or it's bone deformation, or it's just loose debris that's gotten in there. Now, what makes the knees interesting is that they're more of a horseshoe shape, so don't let this fool you, but they have a meniscus, and that meniscus can also tear. And then they have these little tibial plateaus that come down. So those can also deform, which can harm the knee. So in some cases, you know, we're just working on being able to maintain that range of motion. But that's in some of the ways how we would work with an arthritic knee. Now, some people also, and it's important to know, the first time you get adjusted, you can be sore for a day or two afterward. And that's even for the healthiest 20-year-old who goes to the gym every day. And that's just because we're moving things in a way that you might not have had them moved for a while, that may have been restricted. And when we're doing that, we're now using muscles that have been not moved for too long. So if you're looking at the spine and you're off this way, cocked this way a little bit, these muscles are going to be shorter, these muscles are going to be longer. Now that we bring you back to normal and they're equal, these ones are going to be pulled, that's going to make you sore. These ones are going to be loose, and now they need to tighten back up. So it's the same thing with the knees. And it's, when I treat people, it's very, let's figure out what you're able to handle. Let's figure out where we're able to go, and let's go slower rather than jump in full bore right away. But yep. Was that an answer? Anything else, Nancy? Good, okay. So now let's look at bone setters. So bone setters, tradesmen, and women. So like I said, bone setters, you have the people that go in and they're actually setting, they're putting it back. But so back in the day, chiropractic used to be a form of magnetism. And this is where people would actually take their hands and they would use their energy, it's energy medicine, to help heal people. So that was also associated with chiropractic, which is what I think is so interesting, bone setters, chiropractic. All right. So this one, you don't need to be able to hear it, but I do want you to be able to see what let me mute it see what I'm doing. So we're going to talk about the cerebral spinal fluid. Now, this is the fluid that's in the brain. This is the fluid that protects the brain. No, pause. But what I want you to take away from this is just where it comes from inside the brain, how it floats all the way around, and how it goes all the way down through the spinal cord. So we'll see that the pink was filled up. It's going down through the brainstem, down out the spinal cord. It's coming back up, going around the cerebellum, and then it's coming up, and then it fills the brain. And then it goes all the way back down the spinal cord again. So when you have an area down here that is compressed on one side, that is pushing even the slightest bit against the spinal cord, is that going to increase or decrease the cerebral spinal fluid pressure in the brain? It's going to increase it, right? Well, so if you're pinching it off here and it's filling up there, right? So you're going to have problems down below. Now the bottom of the brainstem, now the bottom of the spinal cord is going to have issues being able to keep up. So it's really important that when you have that canal is free from restriction, free from the osteophytes, and free from having any encroachment. So again, this is our healthy one. And then we have here unhealthy. Do we see the difference? I can see you through that. Hey, hi, peekaboo. And this one, there's nothing, not at all. All right. So let's go on to the next slide where we talk about the cerebral spinal fluid. There we go. So it's a critical component to cushion the brain. It's always being made and it's always being taken out. So there's actually little cells at the top of our head that reabsorb the cerebral spinal fluid, and then it's made, which is really cool. So, oops, trying to move that. There we go. So you'll see here, different things of what it does. Cerebral spinal fluid stasis, where it's not being flushed as easily as it should. It's not being created in the way that it could. What can create such stasis? You can have the restrictions in the spinal canal so that it's not able to move up and down. You can have illness, and you can have the subluxations as well. So one of the things that's cool about this is that there was an article, and they did an active MRI adjustment. So what that means is as they were adjusting the person, they were doing the MRI, it showed that at the time that the person was being adjusted in their upper cervical spine area, their brain was flushed with the same amount of cerebral spinal fluid that happens after 8 hours of sleep. So shortly after that, they came out with a study that stated cerebral spinal fluid and proper sleep is what helps to stop people from getting dementia and Alzheimer's. So one could say coming and getting adjusted can help make sure that you stay in your right mind, right? I like that. But, okay. Somehow enlarged the video screen, so I can't see it at the moment. Oh, over there. There we go. All right. So there's more that you can read if you want. You know, it talks about the impulses and the restrictions, but the main takeaway is that the adjustment will help to increase the cerebral spinal fluid flow around the brain and to ensure the proper distribution of neurotransmitters. Something that you can do at home, and I think that this was something awesome, is that you can have a balance board. So if you are using a balance board at home and you're just trying to make sure that you can stay as straight and steady as possible, that's going to help to engage the spinal cord, engage the brain, and help reduce that sedentary lifestyle that we live, which is therefore going to increase the amount of cerebral spinal fluid. In addition to that, jumping jacks, 10 of them a day, clear the lymph nodes of the upper and the middle body. So that also is very good at being able to take out the toxins that our body is trying to take away as well. So here's another one. So I think that this one's awesome. So they did a study on HIV positive individuals and their CD4 count. So the CD4 count is the one that talks about the overall white blood cells in the body. So what they showed is that after 6 months of care, the HIV positive people who had regular chiropractic adjustments had a 48% increase in their number of CD4 cells. So to be adjusted is to increase your immune response, which is to increase your body's ability to beat viruses and to beat sickness and illness over a longer period of time. Now, this is specifically to HIV. However, if you look at what CD4 cells and T cells do, is they help to take care of invaders. So this would be great for anybody who wants to live a healthier lifestyle. And that's why I put this in here for you to be able to look at as well. So let's talk about the immune system. So this one is I love this. So the endocrine system, it talks about how it's part of everything all together. You have your cortisol, your epinephrine, your adrenaline. So if the body is in its misaligned or its restricted phase, or it's having pain, or it's not able to communicate with its outer peripheries as easily and nicely as it should, over time, that's going to wear on your body and you're going to get sick, right? So what this is saying and what we have shown is that coming in order to get adjusted, in order to clear all of that out, increases your immune response. So it increases the cortisol and it turns on the immune system. So it helps to let you be more healthy in a way. So you've got your CD4 count, now you've got your immune system, and you've got both of them interacting to help you live a healthier, happier lifestyle, right? All right, let's see what's next. So dopamine and serotonin. So with this one, this is just very, this is like a very just general, I love this slide because people always go, wow, I feel so much better after. There's two things that's happening. And when you get adjusted, you have a release of dopamine and serotonin because it just makes you happy. It flushes your brain with serotonin, it increases your immune response, and it gives you energy. B, it's one of the only professions besides massage therapy that you come in and you're touched. Every single patient is touched. Every single patient, we come in and we go, hi, you're here. When you have that interaction with another human being, whether it's a cat, well, not just a human being, whether it's a cat, a dog, or a human, it releases different things in your body. So for humans, that releases dopamine and serotonin as well. So coming in and just having that touch also helps to increase your mood and keep you more stable. And then on top of it, we're reducing your pain. We're helping to bring about a better lifestyle changes. And we're also increasing your immune response and the way your body functions. So this is just another sequela or a secondary action of coming in and being adjusted. And it's great. So another, did you know, this, I already kind of touched on this, a full night's sleep washes the brain with cerebral spinal fluid, helps to reduce dementia and Alzheimer's. So let's talk about chiropractic at Ithaca Family Chiropractic. Yay. So here is our website, if you guys want that link. So everybody always asks about price. So we are one of the more affordable area chiropractors in the area. So it's $40 without insurance or with a high deductible. That includes x-rays, that includes your exam, that includes everything. Bring it in. So even though I can't answer any questions about insurance specifically here, because that's all very plan dependent, but don't let anybody think, you know, hey, it's going to cost me $200 to go to a chiropractor. It might somewhere else, but you can always come and send them to me, because for me, it's only going to be 40 bucks. So what we really focus on in our office is being able to get quality care to those that need it, rather than have it be for somebody who's of a different, of the 1%, I guess, is, you know, we don't want that. We want this to be for everybody. So our address is here, 2415 North Striphammer. We're directly diagonal from Chow Italian Restaurant. We are in the JMX building. Used to be a car dealership, I heard, a few years ago. So let's talk about what it looks like when you come in to be treated. So you're prior to your day one, you're going to call and make the appointment, and you're going to say, I was watching awesome Dr. Kris. He did a talk and I want to see him. And then they'll be like, he is awesome. Let's get you in. So you can choose to develop the paperwork ahead of time or bring it in with you. You're going to have your patient history. Boom, we're going to go through it. You're going to do an exam. It's not anything you're going to be graded on, so don't worry. It's what we do, so that's cool. And so what's different about chiropractors is it's kind of interactive. So we're going to have you like stick out a leg and raise an arm. And we might even have you cough, which, you know, hey, cool. We'll do x-rays. We have them right here in the office. So we don't have to send you somewhere. You don't have to schlep all the way downtown. You don't have to go to the hospital, and you don't have to go over there. So instead, we're just going to say, hey, we're going to go right in this room next door. We're going to have them. Boom. What's even cool is right after that, you're going to come into a room that looks similar to this. And we're going to go through and we're going to look at your x-rays because they're digitized. So we're using the lowest amount of radiation possible, and we have them ready right away. So with that, we're just going to do an overall quick, hey, let's look, let's make sure there's nothing out of the ordinary. People have extra bones, which is totally cool and something that we want to know before we start to adjust. Then you can adjust it. Yay! The next time that you come in, it says day 2, it's your second visit. It doesn't mean it's the very next day. You're going to come in, we're going to teach you a couple warm-up exercises. These are things that you do on your own. They're things that we have in the office. There's 2 of them. It takes you 10 minutes. This is to help bring about the changes that we are looking for. We then go over your x-rays. We go over your x-rays alone as a doctor before your second visit. We mark them up with lines and numbers. You get a copy of them to take home to put on your fridge and show your loved ones. We then talk about a treatment plan. What are you looking for? What are your goals? What do you want to do? And how do we get you there? And then if you have insurance, we talk about what your insurance copay will be. Or if you don't, it's the $40, and then you get adjusted again. The next time you come in, we give you this awesome keychain so that you can buzz yourself in. We give you some exercises and stretches. You do your warm-ups. We give you some home remedies, and then you get adjusted. So day 1 is usually about 40 minutes. Day 2 is usually about 25. And day 3, if you get proficient at doing your warm-ups, you're able to be in and out in 10 to 12 minutes, which is great. Unless if there's a line for the chiropractor, which sometimes there is. Usually we're very good about having that, but even with a line, it's still 15 minutes. Now, when I say we give you stretches and exercises and home remedies, I'm not talking about sending you to the gym, and I'm not talking about having you do things for 3 hours. So what I do is I say, here's a list of things over the course of the next couple of weeks, give them a shot. If you like it, let me know. If they don't work for you, great, we'll look at something else. When I'm saying stretches and exercises and home remedies, I'm saying let's focus on certain areas that you want, certain things that you would like to see change. So if you're a typist and you keep getting a pain here, yeah, let's over the course of the next couple of weeks, try a couple of these different stretches or exercises. Let me know which one works. And then we can either adapt that or we can go to something else. But in addition to that, I'm giving you these little key pointers like the dot behind the computer or above the screen. That's going to change your life. I mean, that is something that is so simple that most people don't think of. And I'm not telling you to go to the gym for an hour every day because that doesn't work. Nobody wants to go to the gym for an hour every day. Everybody wants to go home and eat, right? Yeah. All right. So a couple more things that I wanted to look at. So things that are in our office. So here's your nerves, your feelings, your functions, right? So a lot of people say, well, how come I need to come to the chiropractor if I don't have any pain? Well, you've got your motor nerves, your autonomic nerves. These are 1/3 each. Only 10% of the nerve bundle is actually your sensory nerves. So really, pain might be the last thing that you start to feel. So I have people that come in that are, again, wow, I can breathe. I didn't know that I couldn't breathe before, right? Because you had no idea. Or, oh, my hands are stronger all of a sudden. Yes, because one was weak and you didn't know until you got adjusted and you're like, wow, I can actually do this again. So pain might be the last thing that you get. One of the things that I love is when we adjust a baby and they come in and they're colicky and they're crying and parents are like, I hate my life. Why did I procreate? And I'm like, I don't know, but I didn't. So we go and we adjust them, right? And we usually get a phone call and they say, I love you. He slept through the night or she slept through the night. I'm like, great. And they go, and they pooped. Yes. So babies, after we adjust their lower back, will sometimes empty their diaper right inside of our hands. And the reason for that is because they're unable to hold that. They're not sure what that feeling is yet, but we're able to go in and we're able to align the spine. Adults, we go in and we will adjust your lower back, and oftentimes they'll either fart or they'll have to poop after. And that's good. So that's a positive response from the body going, hey, this has happened and now I can talk to this and we got to get that out. And that's great. So I tell people that all the time. You might have to poop in 20 minutes because I do have some patients that drive an hour. You might have to poop in 20 minutes. So if you're on the way and you feel like you do, just let yourself know. And it's just good to know. It's good. So it's a positive, instant positive feedback, which is awesome. Also, I have people that come in with migraines. And I try to encourage them. Next time you start to get a migraine, come in immediately. Let me get that upper neck adjusted. And it usually stops the migraines instantly in their tracks. We've got a lot of people that have been able to reduce a lot of their medications and go off of that as well. So that's great. So if we look on the right side of the screen, we're going to see that it says subluxations. I've been saying that word a lot. Subluxation is also a misalignment. It's the areas that are twisted, rotated, or out of place. So when you have those areas that are twisted, rotated, or out of place, it can put pressure on the structures above and below it. Over time, that can kill or desensitize some of those things. So if you have something that's constantly pinching on a nerve, you can actually kill a nerve. So it used to be called Saturday night syndrome back in the day when somebody would fall asleep with an arm over the back rest of a chair and they would wake up and their arm would be completely numb. And that's because you've been pinching off that nerve for 8-12 hours after, boozing it up. So your body wasn't able to move itself out of that position. Sometimes that feeling doesn't come back. So over a period of time, if you look at it, if you have all these subluxations in the spine, they're all going to add up in some way, whether it's from numbness and tingling, changing of color. I have some people that will just have, one will be all red. Well, it's because the blood's pulling up because it's being blocked because it's not coming in. So whether it's numbness or tingling, strength, right? Hearing, over time, you're going to build up those symptoms. So we want to clear those symptoms out. So what our goal is, my goal is for patients is to get you to maintenance level care. That's once a week. So once a week to once every 2 weeks. Now, for the first few weeks when you come in, we have that where you are misaligned. We get you aligned. But now this muscle was so used to being tight that it wants to pull you back. So for the first few adjustments, we're fighting that muscle memory until we get you to about here, right? So our goal is to get you to that maintenance level care. Boom. So it takes a bit for us to get there. It's like a 2-step forward, 1-step back approach. But don't worry, we'll get you there. We see great results with patients. We take x-rays again at visit number 25 so that you can see your hips get level again. You can see your neck. You can see everything just really makes a great difference. So for all of you being here today, I have a gift certificate. So this is your first visit completely free. So this is going to be your exam, your adjustment, your x-rays, all of it. If you want to take a picture of it, or if you would like an email of this, just let us know when you make the appointment that you want to see Dr. Kris, that you have a gift certificate. You can just show us at the front desk, or if you want to print it off, whatever have it be. And then that's going to be all of it done. Boom. And we'll be able to get you in. So with that, I am done.
Wonderful. Just checking the chat. I haven't seen anything since the question you addressed. Does anybody have any questions for Dr. Kris? Anything you want to bring up? Dottie? Yeah, go for it.
I'm curious as to how this compares with, say, physical therapy.
Great question. So physical therapy and chiropractic really go great hand in hand together. There are some offices where the chiropractor is able to spend more time with the patient to be able to do the rehabilitation. So when you're in physical therapy, you're really looking to have something rehabbed, which really means you need that one-on-one support. You need them to, cheerlead you on to get through something, and you need that support to get through an exercise. With us, we are focusing primarily on the adjustment, and then we're able to give you some of the things that you need. In our office, if we see that you have a need for physical therapy, we have people that we trust and people and other businesses that we work with that we can support you to, but they work best together. So if you're taking the muscle and you're rehabbing that, or you're rehabbing a joint and you're getting things working, but you're not clearing the restrictions for the brain to be able to get to that muscle the best, then what are you really doing? You're doing half the job, right? So instead of paving a road, you're just putting down a bunch of rocks and not smoothing it out. So for us to be used in conjunction, it would be the best, but they're two separate and distinct things.
Mm-hmm. Thank you.
Yep.
Any other questions?
Just a quick one about physician referral. You don't really need a referral for to go see you, correct?
Correct. So I know in some areas and some things you do. For us, you don't. And in the event that you did, we would be able to figure it out. Now, if you need something like an MRI or a CT done, that we would send you back to your primary care. New York has made it very difficult for us to go through all the red tape to have that done and to have it covered by insurance. But you don't need any type of referral to come and see us.
Okay.
I'm sorry, I missed what you said about the insurance part.
So for referrals, you do not need a referral to come and see us.
Right.
But if we're looking for an MRI or a CT or something, or we deemed that was needed, we would send you back to your primary care, and then they would send you out for that. That's not something that we do. So
regular chiropractic adjustments are not covered.
For insurance, it's different. It's different for each plan. So Fidelis, for instance, really does not cover any kind of chiropractic care. Excelis does, Empire does. So we go through and we look at Aetna does. So we go through and we look at each one of the plans. We find out what the details of the plan are, and then we figure out what your copay is, and we go from there.
How about Medicare?
Medicare, yes. So Medicare does cover it, depending on which plan you're on, because again, there's Medicare replacement plans, and there's a whole, there's a lot. but I would just encourage you to come in, use the free first visit. We'll have all the information for you for your second visit. But Medicare, I believe, is an $8 copay. But again, that is only the one plan that I'm recalling to my head right now, which there's a lot.
Thank you.
I've got like really bad stenosis in my neck and in my lower back.
Yes.
And I'm like, how could chiropractic help that? I mean, that's really different, you know?
So for that, again, I would want to talk to you more one-on-one to see what the stenosis is
Yeah.
from, how bad it is, to see if you have any.
It's age related.
So, and that's the thing. So I would want to see, is it actually stenosis? So is it
Yes.
actually narrowing of that?
Yes.
And how much pressure would be on the spinal? So we would want to do a full exam and we would want to go from there.
Yeah.
But chiropractic would be great for that, as we would be able to assist in making sure the movement is still there for the spinal cord and the movement for each of the vertebral bodies and the discs. So if we can help to maintain what movement you have, then it will help as well.
Yeah. Okay. Well, I saw a chiropractor for years. I saw
Yeah.
several chiropractors over the years.
Mhm.
And excellent treatment, you
Great.
know.
Yeah.
You know, it's 5'5", and I went to chemo in 2004, and I was 5'2" in 4 months. And
Yeah.
so they did. When I headed into radiation, we realized that I had pain in my neck when I went for the exam, you know, for the measurement and everything.
Mhm.
And they said, oh, we better do something there. And so after the radiation, we did an MRI of the whole spine. And they just said it was normal disc degeneration. I'm like, well, I lost 2 or 3 inches in 4 months. I don't think that's normal. And they said, yes, it is, you know. But I thought it was probably from dehydration, you know.
And that's very possible too. But you also have to remember, radiation and chemo, it decreases the density in the bones and it can actually shrink the bones as well. So I think there was a few complicated
Wow,
factors there.
I didn't know that. Yeah,
Yeah.
I've been through chemo twice, but the first time around it was a different chemical. So that's where it really hit me hard on the first one. But the thing is the stenosis really is like advanced, I think, because anytime I do a yoga class, I mean, 2 days later, I'm immobilized.
So
Yeah.
it would be great though if you wanted to come in and you wanted to talk.
Yeah, I would like to get some sort of assessment of that, but I am
Yeah.
in the process of that with a physician up in Syracuse. So
Okay.
I will
Or-
be getting an MRI to check it out.
When is that?
They haven't scheduled it yet, but I just saw the nurse couple weeks ago, and they will be scheduling it.
So it would be great to bring that information in with you.
Yeah.
Get it on a
Yeah, I
a
would
disc.
wait. I
Yeah,
would wait until I had the MRI.
That'd be great, and we'd love to look at it with you as well.
Yeah, great.
Yeah.
Okay, thanks. This is a
You're
great
welcome.
presentation. I really-
Thank you.
Yeah.
And I thank you all for coming. I appreciate it so much.
Thank you.
Dr. Kris. Any last questions before we let everybody go for the rest of the night?
No, it was great. I really appreciate it. Thank you.
Great. If you have any questions or you need to get a hold of us, there's our website right there on the page. The email is ithacachiropractic@gmail.com. Just put my name in the attention. Again, I won't be able to answer questions particularly about your case unless if you're a patient and you come in. But if it's questions pertaining to the practice or getting scheduled, go ahead and contact me. And if you need a copy of the presentation as well, don't hesitate to ask. And I'm also, I'll just throw this out there. I don't know where any of you work, but I like to bring food to people's works. You can ask her,
Yeah.
I'll bring food, I'll do a 10-minute talk, you'll get free lunch. And I like to meet people there too. So if that's something that interests you as well, please give us a call. That's free. I pay for that. And we can set something up there too, so your coworkers will love you. It's subs from Wegmans. Who doesn't beat that? Right?
Good to know. Yeah.
Yeah, yeah. All right.
Awesome.
All
Thank
right.
you.
Thank you.
Yeah, you're
Yes.
welcome. Bye, guys.
Have a great night,
Thank
everyone.
you.
You as well.
Thanks for coming.
Bye.
Bye.
Thank you, Doctor.
Yep.
That was